You are watching JapaNEWS. First, this is the article by Dennis Normile on sciencemag.org on May 26, 2020. And Science Mag's COVID-19 reporting is supported by the Pulitzer Center. On May 25, Japan declared at least a temporary victory in its battle with COVID-19, and it triumphed by following its own playbook. It drove down the number of daily new cases to near target levels of 0.5 per 100,000 people with voluntary and not very restrictive social distancing and without a large-scale testing. Instead, the country focused on finding clusters of infections and attacking the underlying causes, which often prove to be overcrowded gathering spots such as gyms and nightclubs. Prime Minister Shinzo Abe declared at the press conference announcing the lifting of the state of emergency. With this unique Japanese approach, we were able to control this infection trend in just 1.5 months. I think this has shown the power of the Japanese model. The number of daily new cases peaked at 743 on April 12, but has varied between 90 and 14 for the past week, according to WHO. Abe noted the number of hospitalized COVID-19 patients has dropped from 10,000 about 1 month ago to now 2,000. The positive outcome has even convinced some skeptics of the nation's cluster strategy. Japan has prevented an outbreak on the scale seen in many Western countries, says a global health specialist at King's College London who previously warned of undetected community spread. He credits the public's cooperation with stay-at-home directives and the fortuitous timing of the emergency. He notes that Japan had hundreds of new cases per day when the emergency was declared, whereas the United Kingdom had 400,000 new daily cases at the time of its lockdown. Hitoshi Oshitani, a virologist and public health expert at Tohoku University, says, despite the lifting of the emergency, the outbreak is not over. He says he's expecting small outbreaks from time to time, although the government may consider reimposing restrictions. He believes that they can manage these smaller outbreaks. Japan got off to a bad start dealing with the pandemic when it quarantined the Diamond Princess cruise ship for 2 weeks in Yokohama after passengers were infected with COVID-19. Eventually, 712 of the 3,711 people on board tested positive for the novel coronavirus and 14 died. Then, whereas much of the rest of the world built its response to the pandemic on widespread contact tracing, isolation, and testing, Japan adopted a quite different strategy, Oshitani says. They tried to identify the clusters and determine their common characteristics. Not surprisingly, they found that most clusters originated in gyms, pubs, live music venues, karaoke rooms, and similar establishments where people gather, eat, drink, chat, sing, and work out or dance, rubbing shoulders for relatively extended periods of time. They also concluded that most of the primary cases that touched off large clusters were either asymptomatic or had very mild symptoms. Oshitani says, it is impossible to stop the emergence of clusters just by testing many people. This led them to urge people to avoid what they dubbed the 3 C's: closed spaces, crowds, and close contact settings, in which people are talking face to face. It sounds simple, but Oshitani says this has been the most important component of the strategy. Reassuringly, they did not trace any clusters to Japan's notoriously packed commuter trains. Oshitani says that riders are usually alone and not talking to other passengers, and lately they are all wearing masks. An infected individual can infect others in such an environment, but it must be rare, he says. He says Japan would have been large outbreaks traced to trains if airborne transmissions of the virus was possible. But through March, cases climbed as authorities ramped up efforts to explain the importance of the 3 C's. Researchers believe that the rise was partly driven by citizens returning home from overseas and travelers. Then on April 7, concern about the trains being imposed on the healthcare system prompted the government to declare a state of emergency in several key prefectures. On April 16, it extended the emergency order nationwide. Japan's national and local governments do not have the legal power to impose lockdown measures. But authorities urged people to stay home as much as possible, companies to allow working from home, and bars and restaurants to close or serve only takeout. Based on modeling, members of the advisory committee urged people to reduce their interactions with others by 80% in order to bend the curve. Oshitani doubts the 80% goal was achieved, but there was fairly extensive voluntary compliance. Shibuya says, surprisingly, Japan's mild lockdown seemed to have a real lockdown effect. Most importantly, the state of emergency bought time to educate the public about risky behavior and environments. Masks now are nearly ubiquitous. There were some bars and restaurants that ignored requests to close or restrict hours, but they are typically not as crowded as they once were. Oshitani says, now people know much better the risks of the virus. Next month, professional baseball will start with empty stands, gradually allowing increasing numbers of spectators. Concerts and cultural events will be allowed to start with 100 attendees, with numbers increasing step by step up to 50% of a venue's capacity. Abe warned these steps will not reduce the risk of infection to zero. We must be prepared for trial and error. It will take a considerable amount of time to completely restore daily life. Now, in addition to what is said in this article, if I can give my 2 cents as a native Japanese currently living in America, I think the key to this speedy recovery is very much related to the obedient nature that the Japanese unite and respect. Personally, I always admire the American way of individualism that respects uniqueness and originality. I don't like to be put into one box. But during this pandemic, I must admit that I have been appalled and disappointed at random selfish behaviors by some American people who do not have the common sense to cooperate and show respect for others. There are also other elements. If you've ever been to Japan, you know they are one of the cleanest people on earth. Public bathrooms are all so clean, like you can sleep in it. When we come home, we wash hands a lot. We always take off shoes. We use bidet for our toilet, which was invented by the company Toto 40 years ago, and we've been using it ever since. We wear masks outside if we have a cold or allergy, not just for ourselves, but also for others as an etiquette. We don't usually hug or kiss or even shake hands that much. My father used to get mad at me when I touched doorknobs or elevator buttons in the public places with my fingertips, decades before this pandemic. I can only imagine how he would strictly act if he was still alive at this time. Thank you for remembering to subscribe now. Woohoo! You are watching JapaNEWS.